Bonjour à tous et à toutes.
Good day, everyone. It's a pleasure to be here with Dr. Tam and Dr. New. With the arrival of fall and colder weather, staying up to date with your immunizations, including booster doses, is all the more important to protect yourself, your loved ones, and the more vulnerable people around you, as well as to protect our healthcare workers. Today, we are achieving another milestone in Canada's COVID-19 vaccine rollout. Health Canada has authorized a second bivalent Omicron targeting COVID-19 vaccine, the Pfizer BioNTech BA.4/5 vaccine, for use as a booster dose.
Achieving yet another milestone in Canada's COVID-19 vaccine rollout. Health Canada has authorized a second bivalent Omicron targeting COVID-19 vaccine, the Pfizer BioNTech BA.4 BA.5 vaccine, for use as a booster dose. These updated bivalent vaccines target two strains of the COVID-19 virus, the original strain and the Omicron strain. This means that there are now two bivalent Omicron targeting vaccines available in Canada. The Moderna bivalent vaccine was authorized last month for people 18 years of age and older, and the Pfizer bivalent vaccine is authorized today for people 12 years of age and older. The National Advisory Committee for Immunization has also released updated guidance on fall booster doses to reflect the authorization of these vaccines. NACI now recommends that people 12 years of age and over who are eligible to get a booster dose this fall receive a bivalent vaccine. These vaccines will boost our immune system and give us better protection against Omicron. If it has been 6 months or more since your last dose, it is time to recharge your immune system, and get a booster dose. This is especially important if you are 65 years of age or older, or you are at higher risk of severe illness from COVID-19. It's also important to protect those around us and our healthcare workers. If you have recently received a fall booster dose with an original mRNA vaccine, you do not need to receive a bivalent Omicron targeting booster at this time, since that's because the original vaccines continue to provide good protection against serious illness and hospitalization. Both bivalent vaccines will boost your immune response and are expected to offer better protection against Omicron. Les deux vaccins bivalents maintenant approuvés au Canada, soit celui de Moderna et
The
de
two
Pfizer,
bivalent vaccines now approved in Canada, Moderna's and Pfizer's, both provide excellent immune response and enhanced protection against the Omicron variant. If it's been more than 6 months since your last dose, it's time to recharge your immune system and get a booster dose.
In addition, an important reminder that with kids now back in school and the flu season fast approaching, we encourage all parents to get their children 6 months to 8 to 11 years of age to be vaccinated with the primary series of COVID-19 vaccine so that they can be better protected. While on the subject of children, and therefore before I turn to Dr. Tam, let me say that I share the concerns from many parents about their ability to find infant and children's analgesics products and understand those concerns. Over the summer months, there has been unprecedented demand for these products, and increased supply has found it difficult to keep pace. We are working hand in hand with manufacturers and suppliers to keep increasing supply, to meet increasing demand, and to ensure that families have access to these important medicines. I personally spoke to several manufacturers, including Johnson & Johnson, Aeon, and PharmaScience, as well as to associations of pharmacists and pediatricians, to reiterate the urgent need to collaborate to find both a short-term and a long-term solution to this shortage, so parents can have the medicine they need to take care of their children. As the health of infants and children remains our top priority, all options to solve this shortage are on the table, and Health Canada will provide regular updates on this situation. Je partage les inquiétudes de plusieurs parents concernant
I share the concerns of many parents about their difficulty in finding pediatric analgesics for infants and children. Over the summer, there was an unprecedented demand for these products, and the increase in supply has not kept pace. We are working hand in hand with manufacturers and suppliers to continue to increase supply to meet demand and to ensure that families have access to these essential medicines. I personally have spoken with several manufacturers, including Johnson & Johnson, Haleon, and Pharmascience, as well as pharmacy and pediatric associations, to reiterate the urgent need to work together to find immediate and long-term solutions to this shortage so that parents may have the medicines they need to care for their sick children. The health of infants and children is our top priority, and all options to resolve this shortage are on the table. Regular updates on the supply situation will be provided by Health Canada. Thank you. I would now like to turn the floor over to Dr. Tam.
Thank you very much, and bonjour à toutes et à tous. Nationally, the COVID-19 disease indicators, including weekly case counts, have increased in recent weeks, which may be an early sign of full resurgence. Despite the usual regional variation, virus transmission is occurring across the country. The Omicron late summer wave appears to have declined very gradually before picking up again after only a brief leveling off in many areas. With the ongoing transmission, hospital trends are still elevated, although critical care trends and deaths remain at a low level. As our contacts and potential exposure increase, with more time spent indoors this fall and winter, we could see further increases in COVID-19 activity. At the same time, we know that immunity from vaccination and/or prior infection decreases over time. Therefore, the National Advisory Committee on Immunization recommends getting a COVID-19 booster dose 6 months after a previous COVID-19 vaccine dose or SARS-CoV infection to maintain up-to-date protection. Across Canada, as more people go beyond a 6-month time lapse since their last vaccine dose or infection, population immunity is falling and leaving us all less protected. Without up-to-date vaccination to help prevent serious illness, many people could land in hospital due to COVID-19. COVID-19 vaccination may also help reduce the risk of developing post-COVID-19 condition or long COVID. As of early September, Canada's booster dose coverage has remained quite low, with just half of the population vaccinated with an additional dose. However, with over 82% of the population having completed their primary series, we have a great foundation to build on to once again become a world leader for up-to-date vaccine coverage. With Canada's recent authorization of the Pfizer-BioNTech Comirnaty bivalent vaccine, we now have 2 bivalent COVID-19 vaccines, booster formulations, as options for restoring protection in people aged 12 years or older. Both the Pfizer and Moderna bivalent vaccine formulations target the original virus strain and the highly infectious Omicron variant. Likewise, both bivalent vaccines are expected to boost immunity against Omicron variants and broaden the repertoire of our immune response to the SARS-CoV-2 virus. Nevertheless, if you recently received a booster dose of an original mRNA COVID-19 vaccine, you did the right thing. When it comes to COVID-19 protection, the most important thing is to stay up to date with your protection. And evidence continues to show that Canada's original COVID-19 vaccine formulations provide good protection against hospitalization and severe disease. So if you've been recently received a primary or booster dose with an original COVID-19 vaccine, you do not need to be re-immunized with a bivalent mRNA vaccine at this time. It's also important to note that in some cases, Canada's National Advisory Committee on Immunization recommends a shorter interval of 3 months may be warranted. This could include cases where there is a heightened epidemiologic risk, such as immune-vulnerable individuals or elevated levels of virus in the community. And your health provider or local public health authority can help guide you in maintaining optimal protection with COVID-19 vaccines. In the coming weeks, seasonal influenza vaccines will be rolled out across Canada. So it's good to know that influenza vaccines can be given at the same time as COVID-19 vaccines to people over 5 years of age. However, while this may increase convenience for some, if you are due for COVID-19 vaccine or boosters now, it is recommended not to wait. So I'll give a quick update on monkeypox. Canada continues to closely monitor the monkeypox outbreak. As of today, a total of 1,411 cases have been reported nationally, with just 5 additional cases reported over the past week. So the outbreak has slowed considerably. In Canada, the use of precautions and risk reduction behaviors, particularly in outbreak-affected populations and settings, have been crucial to control the spread, and now time for implementation and adaptation of vaccination programs to reach those at highest risk. To date, over 86,000 individuals have been vaccinated with at least 1 dose of the Imvamune vaccine across affected populations in Canada. Given adequate supplies, NACI recommends pre-exposure vaccination should be offered as a 2-dose primary series, with at least 28 days between doses to individuals at highest risk of infection. The Public Health Agency of Canada continues to support provinces and territories in their ongoing efforts, including through strong partnerships with communities to maximize vaccination coverage. Encouragingly, recent evidence from the United States outbreak demonstrates that the incidence of monkeypox infection was 14 times lower for people vaccinated with a first vaccine dose compared to unvaccinated people at similarly high risk, concluding that people eligible for monkeypox vaccination should get vaccinated as soon as possible. Specifically, the US study looked at the Jynneos vaccine, which is the same formulation as the Imvamune vaccine in use in Canada. So as we go into the Thanksgiving long weekend, let's do our best to safely gather in person to celebrate all of our efforts and recommit to not lose the gains we've made. Although no individual layer of protection is perfect, when used consistently and together, Vaccine Plus layers can provide excellent protection against COVID-19, as well as many other infectious diseases we may encounter. In particular, improving indoor ventilation where you can, and continuing to wear a good quality face mask, especially in poorly ventilated or crowded settings, are some of the most effective personal protective measures you can take to reduce your risk of exposure and spreading disease. As for COVID-19 in particular, Dr. Tedros, the Director General of the World Health Organization, recently offered the encouragement that we have never been in a better position to end the pandemic. Though we're not there yet, the end is in sight. And we can get there if we all step up and seize the opportunity now to reach and maintain our best protection. Getting your COVID-19 vaccinations up to date with Omicron targeting bivalent vaccine is a key step in seizing this opportunity. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous.
Good day, everyone. Nationally, COVID-19 disease indicators, including weekly case counts, have increased in recent weeks, which may be an early sign of fall resurgence. Despite the usual regional variation, virus transmission is occurring across the country. The Omicron late summer wave appears to have declined very gradually before picking up again after only a brief leveling off in many areas. With the ongoing transmission, hospital trends are still elevated, although critical care trends and deaths remain at a low level. As our contacts and potential exposures increase with more time spent indoors this fall and winter, we could see further increases in COVID-19 activity. At the same time, we know that immunity from vaccination and/or prior infection decreases over time. Therefore, the National Advisory Committee on Immunization recommends getting a COVID-19 booster dose 6 months after a previous COVID-19 vaccine dose or SARS-CoV-2 infection in order to maintain up-to-date protection. Across Canada, as more people go beyond a 6-month time lapse since their last vaccine dose or infection, population immunity is falling and leaving us all less well protected. Without up-to-date vaccination to help prevent serious illness, many people could land in hospital due to COVID-19. COVID-19 vaccination may also help reduce the risk of developing long COVID or post-COVID-19 condition. As of early September, Canada's booster dose coverage has remained quite low, with just half of the population vaccinated with an additional dose. However, with over 82% of the population having completed their primary series, we have a great foundation to build on to once again become a world leader for up-to-date vaccination coverage. With Health Canada's recent approval of the Pfizer-BioNTech Comirnaty bivalent vaccine, we now have 2 bivalent COVID-19 vaccine booster formulations as options for restoring protection in people age 12 or older. Both the Pfizer and the Moderna bivalent vaccine formulations target the original virus strain and the highly infectious Omicron variant. Likewise, both bivalent vaccines are expected to boost immunity against Omicron variants and broaden the repertoire of our immune response to the SARS-CoV-2 virus. Nevertheless, if you recently received a booster dose of an original mRNA COVID-19 vaccine, you did the right thing. When it comes to COVID-19 protection, the most important thing is to stay up to date with your protection. And evidence continues to show that Canada's original COVID-19 vaccine formulations provide good protection against hospitalization and severe disease. So if you have recently received a primary or booster dose with an original COVID-19 vaccine, you do not need to be re-immunized with a bivalent mRNA vaccine at this time. It is also important to note that in some cases, Canada's National Advisory Committee on Immunization recommends that a shorter interval of 3 months may be warranted. This could include cases where there is a heightened epidemiologic risk, such as an immune-vulnerable individual or elevated levels of the virus in the community. Your health provider or local public health authority can help guide you in maintaining optimal protection with COVID-19 vaccines. In the coming weeks, 2022-23 seasonal influenza vaccines will be rolled out across Canada. It is good to know that influenza vaccines can be given at the same time as COVID-19 vaccines to people over 5 years of age. However, while this may increase convenience for some, if you are due for a COVID-19 vaccine dose or a booster now, it is recommended not to wait. Canada continues to closely monitor the monkeypox outbreak. As of today, a total of 1,411 cases have been reported nationally, with just 5 new additional cases reported over the past week. The outbreak has slowed considerably. In Canada, use of precautions and risk reduction behaviors, particularly in outbreak-affected populations and settings, have been crucial to control the spread and allow time for implementation and adaptation of vaccination programs to reach those at highest risk. To date, over 86,000 individuals have been vaccinated with at least one dose of the Imvamune vaccine across affected populations in Canada. Given adequate supplies, NACI recommends pre-exposure vaccination should be offered as a two-dose primary series with at least 28 days between doses to individuals at high-risk of infection. Public Health Agency of Canada continues to support provinces and territories in their ongoing efforts, including through strong partnerships with communities to maximize vaccination coverage. Encouragingly, recent evidence from the U.S. outbreak demonstrates that incidence of monkeypox infection was 14 times lower for people vaccinated with a first vaccine dose compared to unvaccinated people at similarly high risk, concluding that people eligible for monkeypox vaccination should get vaccinated as soon as possible. Specifically, the U.S. study looked at the Jynneos vaccine, which is the same formulation as the Imvamune vaccine in use in Canada. As we go into the Thanksgiving long weekend, let's do our best to safely gather in person, to celebrate all our efforts, and recommit to not lose the gains we have made. Although no individual layer of protection is perfect, when used consistently and together, vaccines plus layers can provide excellent protection against COVID-19, as well as many other infectious diseases we may encounter. In particular, improving indoor ventilation where you can, and continuing to wear a good quality face mask, especially in poorly ventilated or crowded settings, are some of the most effective personal protective measures you can take to reduce your risk of exposure and spreading disease. As for COVID-19 in particular, Dr. Tedros, Director General of the World Health Organization, recently offered the encouragement that we have never been in a better position to end the pandemic. Though we are not there yet, the end is in sight, and we can get there if we all step up and seize the opportunity now to reach and maintain our best protection. Getting your COVID-19 vaccinations up to date with an Omicron targeting bivalent vaccine is a key step in seizing this opportunity. Thank you. Merci. Miigwech.
Okay, we'll start with questions in the room. One question, one follow. We'll start with Emily Bergeron from La Presse Canadienne.
Oui, bonjour. Une question pour Monsieur Duclos.
Good day. Question for Mr. Duclos.
Bon, déjà, il y a plusieurs millions ou milliers ou millions.
There are either thousands or millions of doses that have expired that were not used in time. And here we're looking at another new vaccine. What will come of those prior generation vaccines? What are you going to do to avoid any mass waste of vaccine doses? Thank you. There are many goals in the context of our framework. The first thing is to make sure that Canadians have access to the best possible vaccines in a context where COVID-19 is continuing to cause harm in individuals, families, healthcare workers, and all other patients other than COVID-19 patients, anyone who has a hard time getting access to diagnoses, treatments, and want to take care of their health. Our number one goal here is the security and quality of vaccine supply. Another goal is to make sure that all of this is done in an effective and responsible way when it comes to these doses that already exist. We want to manage that well. With respect to people who will be getting a booster dose, the current vaccines, there are people who are going to be making that choice to follow that original recommendation. Now, as to managing the bivalent vaccine doses, Public Health Agency of Canada will make sure that if we can expect that there will be doses not used by Canadians, that those doses can be offered to countries abroad or managed in such a way as to make their availability, make sure that their availability lasts for a longer period. We know that some people will choose to get vaccinated very quickly. Others will choose to wait a few months, maybe to the new year or later in 2023. Responsible management of vaccines does require spreading out supply and administration over several months. As a follow-up, you mentioned this in your opening remarks. Acetaminophen for pediatric uses. One of the solutions that was raised, even actually this week, was to loosen criteria with respect to labeling. In other words, have products come in that might be in a foreign language. The question was asked of Dr. Sharma earlier on. That avenue has already been taken. Can you clarify where things stand on that front? Answer, I'll start by saying, again, this is an important, concerning issue for us, our families, that there are young families that are not having access to analgesics for their children. It's really critical in many cases. And that's the case not only in a context where it reduces fever, pain, and discomfort, but it also means children can avoid landing in emergency rooms, and it also means they don't have to stay necessarily in hospital settings. When families have access to these analgesics for their kids, it's good not only for obvious reasons, for individual health, for those individual children, but it also protects the healthcare system as a whole. It prevents us having children who end up in hospital. This is information that pediatricians are sharing with us, family doctors are saying to what extent it is important for families and children to have access to these drugs. The other thing is that I personally, over the last few days, heard from suppliers, producers, manufacturers, and pharmacists, and I was told, I was assured that an increased, accelerated production rate was going to continue in order to meet the increased need that we've noted over the last few months, and which likely could continue over the next few months. What we're noting, and this is from the pediatric community and the healthcare system, we've noted over the last few months that there has been a significant demand because there are viruses that are circulating that perhaps at other times might not, meaning that our children are getting sicker than usual, and we are concerned for the coming months because we know the flu, other respiratory viruses, and certainly COVID-19 will continue to impact our children's health. So industry, pharmacists are assuring me that the increase in the last couple of months in terms of their increased doses and availability will be something that they will be pursuing over the coming months. What I've had discussions with partners is that there are emergency orders available to facilitate production and import of products that are usually not necessary in the country. These emergency regulations are available. You can have access to them when required. They know this. And it includes some flexibility when it comes to labeling. However, on that front, of course, labeling that is, let's say, unusual has to be at least sufficient. And in context where it's also provided with additional fact sheets for families so that when they get access to these drugs, have access to the information in both official languages, the kind of information that would be required for them to be able to use this medication.
From the Toronto Star.
Hi, Minister Duclos, just picking up on my colleague's question. What have the companies told you about when this shortage is going to end?
This shortage has been there for quite a few months already. And the main reason is talking to pediatricians, what physicians and other healthcare professionals have seen over the last few months is our children have been more sick through all sorts of respiratory viruses and other conditions that were not usual before COVID-19. And therefore, they have obviously needed more of these analgesics. and therefore the demand for such drug has significantly increased over the last few months. Fortunately, supply and production have also increased significantly. Depending on manufacturers, the supply has either increased between around 50% and sometimes has even doubled or tripled. But that has not been enough to address the significantly increased in demand for analgesics. They have assured me that the supply will keep increasing over the next few weeks and months to restock the inventory that has been low over the last few months and weeks, and obviously to prepare for the increased demand that we are that we're going to continue to see over the next few weeks and months as COVID-19, the flu, and other viruses impact more the health of our children. I have also reminded them that there exists emergency regulation that they can call to and use if that is useful for them to increase the ability to have access to active ingredients, to facilitate the effectiveness of supply chains, to import quickly and more efficiently whatever drugs may be needed to supplement the domestic production of those drugs, and any other type of regulatory agility. I have reminded them that this is available. They just need to ask. So I have also asked pharmacists, physicians, and producers and suppliers to work even more together to make sure that families and children have access to the drugs that they need, they will continue to need.
If regulations exist that they could use, what's your understanding of why they're not using them, and why haven't they used them in the last 6 months if this has been a shortage dating back 6 months?
They have used some of them, but there will be more. There are more that they can use. They obviously know what's most effective and useful for them. Some of these regulations would at this particular time be, I understand, of little use for them, but they know these regulations exist, and I have asked them to be very proactive and very quick in letting us know how we can support their use and their availability to them, and therefore to the benefit of our children and families.
Kim Vermette from Radio-Canada.
Bonjour à vous. Une question d'abord pour vous, Monsieur Duclos.
To start, a question for you, Minister Duclos. Some experts are saying at Radio-Canada that the new COVID vaccine, the Pfizer vaccine, would be more effective against subvariants than the Moderna one. Could you tell us about the efficacy of this new vaccine? There are people who really want access to that particular vaccine. What we're hearing from experts, in fact, there are two experts right here in the room today, is that we now have two vaccines, two specifically designed to fight Omicron, both very good. Experts are telling us that Omicron, of course, shares some distinctions, I mean, when it comes to these subvariants, but the important thing is to fight against Omicron. Both vaccines are both good and superior to the existing formulation. Now, with respect to the existing formulation, the bivalent option is very good as well. It's even pre-bivalent, but it's even better now that we have this bivalent vaccine. Dr. New, Dr. Tam, if you had anything to add. Thank you, Minister. Not much to add other than to say that out of these two vaccines, you're looking right now at a bivalent vaccine. It contains something to strike against the original variant and now against the Omicron. Given all the evidence we have, both provide good protection against Omicron and the original strain. So I think it's important to remember that if something's being offered at a local level, either of the bivalent vaccines should be are good and people should take them. It's not really a matter of choice or choosing. The most important is to get the bivalent vaccine. I think everyone over 12 should focus on this to get the booster shot if it's been more than 6 months since your last dose or your last infection.
Merci beaucoup.
Thank you very much. Another question for you, Minister Duclos. Provinces are responsible for the distribution of vaccines. Do you find provinces are doing enough to promote this booster shot? I do hear your concern expressed about the coming fall season. Are you concerned about how things evolve? Answer, yes, I am concerned from what I'm hearing from the experts that are telling us two things. One, that the coming months, the coming weeks will be critical when it comes to COVID-19 infection and all consequences this can have for people and for healthcare workers who are already quite tired, who want to try to deal with the backlogs in terms of surgery, cancer, diagnosis, and illnesses for which these physicians really did not have enough time to address. I am concerned. The other thing that experts are telling us is that we have vaccines that are very effective and they work even better now, given these bivalent vaccines in today's announcement. Furthermore, what we know is that if we do better use, make better use of these vaccines in Canada, we will be able to significantly reduce the hospitalization rate that we will observe towards the end of the fall and early 2023. One simulation done by Public Health Agency of Canada was to say if you went from 60% to 90% rate of third dose, then you would reduce by 80% the rate of hospitalization that we will see at the end of the fall season and early winter. That's 90% fewer people that would be ill or healthcare workers that would be severely impacted, and all the other people that are going to need care in our hospitals. We are lagging behind as far as the third dose is concerned compared to other countries. The last few weeks have been encouraging. We've noticed that in Quebec and elsewhere, specifically as of the month of December where the Moderna vaccine was available. People have realized that these vaccines are available. We're going to have to accelerate the access to this information, but also actually access to the vaccine itself. We want to simplify people's lives. We want these vaccines to be accessible to people. People don't have much time. Do we go to the schools? Do we go into these mobile clinics, healthcare centers, into companies, businesses? These would be ways to facilitate vaccinations and protect everyone in the coming weeks.
Glenn McGregor, CTV News.
Mr. Duclos, your government's been promoting booster shots since sometime late last year, and yet, as Dr. Tam said, only about half of people have gotten a booster, and the people getting a second booster, a fourth shot, is something like 13%. Now you're here promoting a vaccine that could be used as a fifth booster. Doesn't seem like this is going very well. What is the problem here? Why are people not getting boosted? And is it because your government is communicating a mixed message? You're getting rid of border measures, you're getting rid of mask mandates on trains and planes, and at the same time you're trying to get people boosted. Why is this not working?
A, as we know, we've done really well with 2 doses. B, we are lagging behind other countries in terms of third doses. C, the situation has improved over the last few weeks. We've seen an uptake in more doses, and equally importantly in the number of people being up to date in their vaccination. And D, we need to do better and much better over the next few weeks and months if we want to protect everyone and protect our healthcare workers as well, who need help. So we know, for instance, that if we were to increase the number of people in the relatively short time vaccinated with the third dose among adults from 60% to 90%, we would reduce by 90% the number of hospitalizations that we will otherwise see in the end of the fall or early 2023. 90% reduction in the number of hospitalizations that we would otherwise see end of the fall, beginning of 2023. That's a big impact. That's a big impact. Obviously, protecting Canadians against the severe impacts of acute long COVID, against the long-term impacts of long COVID, which is an issue to which we'll come back in shortly, because important work is being done by PHAC and others within the government to explain to Canadians the risk of long COVID. Many Canadians are aware of that already, but there is a serious thing happening in Canada and elsewhere in the world around long COVID, and vaccination against COVID-19 helps both protect against COVID-19 infections, but also protect against the long-term impacts of being infected with COVID-19. So these are all reasons, all important reasons to be doing better over the next few weeks and months, and we'll be working increasingly collaboratively with provinces and territories to see how we can increase the value of doing that, but also the accessibility and the ease of having access to those strong and valuable bivalent vaccines.
Those are statistics that are not always compelling to everyone. Sometimes examples are more important. Yesterday, the leader of the opposition went on CFRA radio here in Ottawa and said he had been twice vaccinated, which of course is the minimum requirement for him to step into the House of Commons. Wondering what kind of example do you think that sends, and would you say something to him about that, about whether he should be more outspoken about advocating for booster doses?
I think we should all be, and I will turn to Dr. Tam in a second. I think we should all be advocating for that. No, we all gain in having more people around us being up to date in their vaccination status. We all gain because that reduces infections, it reduces severe cases of COVID-19, it reduces long COVID. It also protects our healthcare workers who are in a crisis and have difficulty addressing needs others than those related to COVID-19. But let me turn to Dr. Tam.
But do you think he has an obligation as an elected official to set a better example on that?
I think we all have an obligation, and particularly elected members of parliament who have access to the type of advice that Dr. Tam has been providing now for some time. Now, it's not as if we are not aware of the importance of being up to date in terms of vaccination. Members of parliament have access to that information on a daily basis, through all sorts of exchanges. But Dr. Tam, obviously you have a role, a responsibility to be perhaps more balanced than I would be when I speak about members of parliament. But if you can speak briefly about the importance for everyone to be up to date in their vaccination status.
Yes, so getting the first 2 doses is obviously very important. And it still provides protection against serious outcomes. But ever since Omicron appeared, that was the moment when all experts, the vaccine experts, National Advisory Committee on Immunization, has recommended an additional dose because it's simply not enough in the Omicron era to have 2 doses. And now we learn over time, of course, about waning immunity as time goes on, which is why we're recommending boosters if you haven't had one in the last 6 months. And now with updated boosters, you've got even more opportunities to increase your protection and also broadening the immune response. So I do think that it's important not just for individual protection, but to protect each other and to protect against the health systems. As leaders, we all have a role to play. We're examples that people follow, and I think it's important to do so. I do think individual stories are very important, and many, it's been very helpful to have people that have helped answer questions and have actually spoken out quite frankly about their experience of having very prolonged symptoms, for example, after having had an infection. Many people after a whole year or even 2 years haven't recovered their previous normal state of health. So again, as Minister Duclos said, we will be obviously looking at our data and boosting our understanding as well as our recommendations on long COVID itself, a significant impact on the economy, on our labor workforce, and certainly on the health system.
Excuse me, I'm going to use moderator's privilege to ask a question from this spot. Minister Duclos, I haven't heard anybody really talking about the deliveries of these new vaccines. They're authorized. When are we actually expecting to get deliveries of BA.4, 5? How many are we expecting to get? And is this going to impact how many doses of the BA.1 and the other vaccines that we're getting?
Good. Two answers. First on Moderna, second on Pfizer. On Moderna, we currently have about 10 million doses of the bivalent vaccine that was authorized earlier in September. On Pfizer, there will be about 2.8 million doses delivered around next week, and a total of approximately 11 million between now and the end of the fall.
And is it, I mean, NACI's now recommended that who should get it, but is it still going to be distributed based on what provinces are asking? Is there going to be any change in how it's being distributed because of the bivalent nature?
I don't think the mechanical work of making those vaccines available to provinces and territories that's going to change. Do we know if the bivalent formulation needs different ways of being transported and stored than the earlier formulation?
No, but we've had a very prolonged relationship and collaboration with province and territory over the last many months at figuring out vaccine distribution. Of course, every jurisdiction will have a chance to get access to both of these bivalent products. They are, of course, submitting their needs and requirements as we speak, certainly as new products are coming along. But we've worked out a quite an intricate way of looking at the provincial demands.
Okay, I don't see any hands raised on Zoom, so that'll conclude today's press conference.